How does somebody really know they're a candidate for weight loss surgery?
Well, that goes back to the BMI. So usually we use the BMI to determine if a patient is a candidate for surgery. Today's guidelines have been modified and recently were updated by the Society of Bariatric Surgery and the International Federation of Surgery for Obesity. And now weight loss surgery is recommended for patients who have a body mass index higher than 30 with obesity-associated conditions such as type 2 diabetes. This is diabetes that is difficult to treat, and they have made attempts at weight loss in the past. Or when the body mass index is 35 or higher, with or without comorbid conditions. Now, these guidelines are brand new from October of last year, and insurances, not all of them, are on board yet. Insurances are still following the old guidelines that are BMI of 35 with obesity-associated condition or BMI of 40 without conditions. There are some insurances that are getting on board. I read an article last week that Blue Cross Blue Shield of New Jersey adopted the new guidelines and they're now approving for the new recommendations.
So we do have options, and patients say, okay, I want to have surgery, but how do I know what's the best option for me? And I got to tell you, that's a difficult question for us to just answer generically. These patients need to come in and see us, and one of the differences about our program is that we surgeons see these patients up front. We evaluate these patients individually, go through their medical history, go through their activity, their weight loss history, and we help that patient to understand what their goals of weight loss are and what maybe comorbid conditions they have that may affect what choice of an operation. So we will put that patient into the right operation at the right time. So the sleeve gastrectomy may not be the right option for somebody who's got really bad reflux. It may not be aggressive enough for someone who's got severe diabetes. The duodenal switch may be the best option for a patient who has a severe case of obesity with a very high BMI. So we do have the different surgical options, and I think our practice individualizes the use of these operations. And we are surgeons that only operate on obesity. So this is what we do, and this is all that we do.